The interesting thing about this is that in terms of utilizing it for long-term antiplatelet therapy, the data is not as clear-cut. It's clear-cut in the sense that we can utilize long-dual antiplatelet therapy and have a benefit. And of course, the benefit trade-off is less secondary MIs and complications like that. But there's always the trade-off of bleeding if we're treating them long. However, in terms of if we look at the data that we have, the Plato trial, which looked at ticagrelor versus clopidogrel, showed both superiority of ticagrelor over clopidogrel, and also a benefit in terms of all-cause mortality for ticagrelor, which is great. The problem is the Plato trial only went 12 months. So when we're looking at it from a long-term perspective versus clopidogrel, it's hard to say there. If we fast forward to the DAPT trial, which basically took patients that were receiving 12 months of either clopidogrel or 12 months of prasugrel, majority of the patients were on clopidogrel. And then they basically assigned patients to placebo, and the treatment patients were continued on clopidogrel or prasugrel if they tolerated the first 12 months without a complication. And what we saw in that trial was a greater benefit in terms of overall reduction in a composite of MIs, strokes, and so forth. But the interesting thing is it was strictly clopidogrel and prasugrel. So, and then finally looking at the Pegasus trial, which took patients that had MIs and who were not, at that point in time, they were more than a year out, they were at least a year to 3 years out. And then they were on an aspirin, but they added back in ticagrelor at either a dose of 90 twice a day or 60 twice a day. And what we found in that trial, again, was an overall benefit in reduction of complications in MIs.